orthopedic oncology, we're treating patients with cancers of the soft tissue or muscle or the bones, and we work together with other members of the oncology team, like radiation oncologists that provide radiation, medical oncologists that provide the chemotherapy, and pathologists to help make the diagnosis, radiologists to make sense of all the imaging with us. So it's usually multidisciplinary care. In my practice and in most orthopedic oncology practices, we treat patients in a multidisciplinary fashion. That means that patients are discussed at rounds and their care is discussed. We'll review their imaging, their pathology. We get an opinion about whether they need chemotherapy or radiation. Unlike general orthopedics, where we may work independently, in orthopedic oncology, we work with a team to provide the best care. So because other members of the team may have expertise in the latest clinical trials and chemotherapy, or the expertise in terms of radiation. So we work together to provide the best care and to obtain a cure of the cancer.
There wasn't any one single oncologist or anything. I had 5 different specialists that I ended up having to go to and was lucky enough to deal with. They were all excellent.
As an orthopedic oncology fellowship-trained surgeon with 14 years of experience, I am very comfortable taking care of patients with a wide variety of bone and soft tissue cancers. Orthopedic oncology as a specialty has evolved over the years with the help of MRI and advances in technology and advances in surgical technique. We're able to now save someone's limb. So whereas a cancer would be close to nerves or vessels and so on, with surgical techniques that have developed with the help of other surgeons like vascular surgeons, plastic surgeons, even tumors that were wrapped around the vessel. I've removed the tumor and we then tie off the vessels and we do a bypass. And in a situation where the patient may have lost their leg or lost their arm, we're able to do a bypass, remove the tumor and save their arm or save their leg. I also do major pelvic reconstruction, so a cancer in the pelvis that may be close to bladder or other organs. We work together with the general surgeons and remove the bone cancer, but also do major reconstruction. So we use more complex hip replacement type of implants where we can actually put together the pelvis and replace the hip. And whereas, we would have in the past just left the leg short, now we're able to actually restore the leg length, patients able to get back to their activities. So not only are they getting to keep their leg, but they get back to their function as well.
When I walked into his office, my life was in disarray. I didn't know how long I was going to live. I didn't know where up from down was. And the first thing he said to me, "This is too close to the knee to just try to mess with just taking the one spot out." So I have a knee replacement and a femur replacement on my right femur and right knee. I have no more cancer in my leg. When I see Dr. Deheshi, I get x-rays every 6 months. He examines to see if there's anything in there, and there's no cancer there at all. Well, we had to take one step at a time. He referred me to Dr. Deheshi to take care of the cancer on my leg first, and then later my oncologist was going to take care of me as far as my lungs and my kidney. So we had to take one step at a time. He referred me to Dr. Deheshi and I did the surgery. And then once I was healed up and the wound was sealed, then I could start my therapy with my oncologist. He said patients have been proving us wrong for years, and they've been living 20 to 30 years. And Richard, you're going to live 30 more years. We're going to take care of this. I went in there with zero amount of hope, and I left with infinity amount of hope that I was going to beat this thing. And Dr. Deheshi is the best doctor ever.